Oh,
Yes.
anything else? Any final thoughts? We went over the presentation and it was brilliant. So I'm expecting better today. I don't know if it can be, but definitely everybody has their piece to the puzzle, I like to say. Anything else? There's no slides.
Yeah, I'm pretty easy. So just, I'm pretty informal. So feel free to interrupt and, tell folks to ask questions as we're going along. There's no reason to wait till the end. I'm a big advocate for asking questions as they come up.
Okay, yep. Sounds good. I like that because this is totally informal. Just, we don't want to make it, that's why we said no slide deck, because then it becomes more of a, we're the teachers and we want this to be engaged. So definitely, I'm with you. Okay, guys, I think we're 1 minute away. And I know we'll do well. They love this information, so definitely excited. And then Rebecca, you got the run of show as well. Are you going to put the links that I did put some on there? Did you get the run of show?
Sorry, I hadn't looked at that yet. Is that email?
Yeah, because I put down the californiabridge.org rather than put all of the different links, really the californiabridge.org and hospital education. And then the registration for the next training, which is on the 28th.
Oh, got it. Kara, would you mind popping those in the chat?
Yes, I will send that to you.
Okay, sorry about that.
No worries. I'm gonna let people in,
okay.
But I'll send that to you as I do that.
No problem. We're ready to roll. Hi, welcome everyone. Is it?
Hello.
Hi, Tommy. Welcome, welcome. We're getting some people. We're waiting. Okay, we'll wait a few minutes. Caroline. Okay, hello everyone. As everybody enters, please put down what facility you're from. We want to know where you're coming from. Welcome, Elvia, Gerald, David. Please put it in the chat, the site that you work on, and welcome to our Navigator update. This is a very informal technical assistance meeting. We encourage you to ask questions as we go along. Make sure if you do have a question that it's addressed to everyone in the chat, because sometimes it only goes to the panel and everybody wants to know what the question was. So we want to make sure definitely that everybody gets the question and the answer. We're going to wait for a few more people to show up. I think they're coming along. Hello, Jeffrey from Marin Health. Elvia from Hanford. Stephanie from Roseville Kaiser. Welcome. Yeah, so as everybody's logging on still, we're getting Emerson from St. Mary's. Welcome, Emerson. How's it going? Dale, I'm glad you're joining us from Temecula. So we're all over California today, from northern to southern. So we have a great speaker today. I'm really excited because this doctor's from the South Bay, our Southern California region. Most of the time we have speakers from Northern California, but we have a regional director from Southern California, specifically Palm Desert, Palm Springs area. So how's the weather over there? I'm sure it's beautiful. It always is. I love that. Definitely want to remind everybody, we want to thank you again for all the hard work you're doing out there. We know mental health and substance use is on the rise, so we know you guys are working hard. And some great information we would love to share is that we are approved for additional funding. There will be a new grant on the horizon, hopefully in the next few weeks. I'm not giving dates yet, but make sure that you are getting our emails, that you are not having that firewall. We've noticed several times that some of the emails and correspondence that we're sending out are caught in your firewall. So one thing I did want to make sure is if you're not receiving our emails, ask your IT, because sometimes they're quarantined. Okay. I know I'm with the system that quarantines mail, and until I release it or ask IT to release it, I will not get anything sent to me from that organization. So please make sure, you guys, that if you are not getting emails from us, check out with your IT department. Very, very going to be very important in the next few weeks when we announce our funding, our request for you to apply to our new grant. So very excited about that. So look for more information in the next few weeks. And also the last reminder is about Slack. We love our Slack channel. It's a great place to pose a question any time of the day. Not that we're going to answer it any time of the day, but we will address it. There is a All Sons channel and there's a clinical channel. So if you also have a clinical question, this is not for emergency questions. That should go to the substance line, and we'll post that phone number. But if you just, in general need help or need support or community resources, there's also a community resource channel. So we really encourage you to use that. That's one way that all of our sons stay in contact and keep up to date with what's going on. So again, we also have mentors that do their real chat time. So we make announcements for that. So also, I think that's enough of the announcements. I think we got it. So next, I'm going to get started because we have a lot of content to talk about. We have our panel today. And as I mentioned before, we have Dr. Sharam Laftapour from Eisenhower Medical Center in Coachella Valley, or Rancho Mirage, I'm sorry, Palm Springs. I always put it all together. Sharam, I'm so sorry, but the weather is always, that's one of my favorite places. I love it out there. Love the warm weather, except when it gets like past 110. I gotta say, I'm not
it's only a few months like that, only a few months. The rest of the year is nice.
Beautiful. I know I'm vacationing in December and it's just gorgeous. So again, he's going to present along with his son. He invited Darian Silver from Eisenhower and our own Rebecca Bartley, our son mentor. So welcome all three, and I'm going to hand the floor to you, Dr. Laftapour.
Oh, thank you so much. I hope the volume is okay. When you were talking about that you have a great speaker, I thought you were talking about Darian and Rebecca, because I know it's not me. So anyway, I'm a physician at Eisenhower. I'm actually the program director. We have a new emergency medicine program. I'm originally from UC Irvine. I've been in academics, and I'm kind of a late bloomer. Initially did medicine, and then while in attending, I did master in public health and kind of fell in love with public health, and this is all along the public health lines. Before that, I was in alcohol, trying not to drink, but to get people to stop drinking. So I was in screening and brief intervention for alcohol, but now definitely also trying to help with opioids. I'm very privileged to be part of California Bridge. I really feel that California Bridge is a group that's all about helping each other, and hopefully you're getting that flavor and that kind of feeling by participating. I haven't been part of an organization that they want to help each other as much as I've seen in California Bridge, and I wasn't anybody that started it. I just recently joined a little over a year ago, and so I'm very, very happy. Anyway, I'm here. I'm working with Darian Silva, who's our amazing son, and she's going to tell you a little bit about what she's doing. We had some questions that they asked, but before I get to the questions, I just kind of want to give you my perspective on, as you guys are facing challenges, I really view it as a team activity. So hopefully, first and foremost, that you have a champion or somebody that you're working with. Doesn't have to be a physician, but sometimes it helps to be a physician along with maybe other individuals like, in the social work department or in the nursing department or in the quality department. I just view sometimes it's a little easier if there is a physician champion, and it doesn't have to be the medical director. It could be just any of the attendings in the emergency department. The main reason I mention that is that, it's sometimes a little easier, just if you're trying to disseminate information and you're trying to ask them for things or, encourage them to do things if it comes from one of their own. Not that it is any other reason, but it's a little harder to ignore that email, and because they're going to see him on shift, if not that day, the next day. So they're going to say, "Oh, let me read what that says," because he might ask me about it when I see him on shift. So I think try to disseminate some of the information. I know. The key part is when you're hitting, some challenges. I really view the challenges, often it's maybe one or more physicians that are not team players when it comes to stuff like this. Either they're not sure about it or they're questioning about it or all of this. And I view that as, it's a lack of education most of the time. They just don't know. I don't think anybody's trying not to do this on purpose. So I think that is often a time where that champion can, step in, help with education, either that individual or all of the attendings at like one of their faculty, one of their attending monthly meetings, or one of their grand rounds, or some educational session, or an all hospital session, or any of those different activities. And I really think the important thing is that you don't feel like this is your job to change that one or few person's impression. I really think that it's not your job. It's not a reflection on your work. And I think it's something that, I don't even feel it's my job. But, I try. I don't mind talking to people about it and trying to educate them. But if it's not, it's really up to the medical director, or if the department has a chairman, to really try to do that. Or it could be the quality department that, steps in and says, hey, this is part of our quality metrics and you're not meeting those metrics. So there's a many different ways to kind of get to them, the person that's not willing to do what's necessary. Again, I'm open for questions. So if you guys have questions, I don't know if Sherry wants you to put it in the chat or just kind of unmute and then she can call on you or something.
Yeah, absolutely. Absolutely. You can put it in the chat. I know I have some questions that I've already received, Dr. Leftapor. And one of the things we wanted to bring this topic is promoting your MAT program, and the tips for pushback is just basic. How do we engage our healthcare providers, such as our doctors, our nurses, or especially our nurse practitioners and our PAs? You're constantly talking and approaching them. So what is it, Dr. Leftapor, how should they go about just engaging them? What's the best tip?
Yeah, I think the best is when you have a patient. Obviously, you guys do this day in and day out. So I'm kind of preaching to the choir here. You guys are doing this on shift day in and day out. So I really think the best time is when they have a patient, when they need something to get done. And I obviously you can email stuff and all of that, but emails often get overlooked. And but I think the other time is a short little educational session at their attending monthly meeting where 5-10 minutes, 15 minutes max, where you're like, hey, let me tell you about this cool thing. And obviously have the son there, because that's really, you guys are the key to this whole thing. I really view MAT as not working without a son. It just doesn't work unless obviously social work is all in on it, which is pretty new for them. And I'm not sure how how engaged they would be on this, or even know how to do it as much as you guys would. So I really think, you do some education, but it's really one-on-one between you and the attending. You have one success story. If there's a way to kind of spread that to tell folks about how we can speed up their care and make your lives easier, and make it less of a burden on you. I really view these patients before MAT as a challenge, because there's not a good solution if it's not for MAT when these guys present to the emergency department. Before that, it was a pretty prolonged stay, and from a physician standpoint, a pretty painful stay trying to get them out of the ER. But with this, it's a pretty quick stay, sometimes too quick. They leave before they get their referral, for outpatient care. So.
And I love the way, Dr. Leftaport, that you said emails don't always work as far as training and education. Wait for the patient to, that you're going to consult together with, and maybe ask to speak at the medical committee meeting. Those are great suggestions. Another question we always get is, how do I even start a conversation about harm reduction and naloxone? Several of our substance use navigators just don't know who to talk to and how to begin this conversation. What do you suggest?
I'll kind of leave that maybe to Darian. She can address that. But I really think, naloxone by itself, I think that's kind of standard of care. I think it'd be hard for people to say, I don't want to do naloxone. If they are, then I think maybe a bigger conversation with them is necessary. I think it's pretty standard to just anytime, to prescribe that now with any prescription that you're sending out, or for people that you're worried about. I think that would be pretty surprising if somebody pushes back on that. I think I'm not sure why. I mean, they're giving them without a prescription, so why would you be worried about giving it with a prescription? But maybe Darian can give some tips on that.
All right. I have one more question for you,
Sure.
Dr. Laptapor. What about when you go to a healthcare provider, a MD, an NP, or a PA, and you've done your spill about buprenorphine and the patient needs it and they say no? What should a navigator do at that point?
Yeah, I mean, I think it's a challenge. I think number one, that's why having your physician champion there, because I'm not sure how they're going to treat that patient if it's not for you. But I mean, what are they going to do? I mean, are they? I'm not sure. I mean, they're there unless they're going to refer. I mean, I'm not sure what they're going to do. I mean, are they going to tell them to go to a methadone clinic? I'm not sure what they're going to do. I don't think there's a quick solution if they're not willing to do bupe. I really think the reason they might not do it is they don't know how. They're not sure what dose, and they're not sure, how long do they need to be off of narcotics? Do they need to or not? Any of those things. And, what if they start withdrawing? Now, what do I do? I really think it's those kind of questions that, can get addressed for them. I don't think it's a matter of, they just might not know about how to dose it, how often to give it, how many doses to give. And then now what happens? I think they're all worried, and you're the solution to their problems at that point. They're all worried, then now what do I do? And the answer is nothing. You just give them this prescription and I take care of it from there. So I really feel that kind of reassuring them that, you don't have to, this is not someone you have to keep following, and you're not going to get phone calls or emails about it. I'm going to take care of it, and I'm not going to be coming back to you for another prescription or any of those things. None of those are going to hopefully come true. I can take care of them. But I really think that if somebody's not willing to do it, and that's really why having a champion in the ER is important, that you can have them kind of gently make some recommendations. But I really, honestly, I'm be open to what I want to know what they're going to do with the patient if you don't give bupe. I mean, what are you going to do with them? I just would love to know what if they end up doing? Do they give them like narcotics or something? I mean, that would be like the worst of all circumstances.
Yeah, definitely good points to raise. Now, I know when we talked in prep for this meeting, you mentioned a really good strategy, Dr. Laftapor, about the concentration. Don't concentrate on the physicians that are not going to help you and prescribe. Can you remind us just
Yeah,
about that?
I really want to tell you this has nothing to do with the subject, the MAT subject. It's, I think, pretty prevalent in medicine. So, new things come, and this is not new. So I don't want to give you the impression this is new, but you know, newer practices become more prevalent, and then, in general, most physicians are not the ones that like to be the tip of the spear. So I think it's important for them to realize this is not a new treatment. It's very safe. It's blah, blah, blah. You can give them as much information as they need. But let's say this is, you have a good number of physicians that do this. So instead of focusing on the ones that don't, I would say put your energy and your happiness and your joy of being working on the ones that do, and then the others will come around. I really view it as, this is, you want to focus your energy on the majority. You're not there to change the minority, and that is, in my opinion, not your responsibility. Your responsibility is helping the most you can with the least amount of resistance, and focus on the ones that are going to help you, and focus on the individuals that are going to help you. And one way to do that is if you have two physicians on, and one is very supportive and one is less supportive, and it would be a painful discussion, is that patient's coming in, or you see him in the waiting room, is go to the one that is and say, hey, you want to pick up that patient? I'll take care of it from here on. It's however way you want to cut it. But obviously I just view that the nurses at triage know why they're there, and they might notify you right away, and if they do, then you can get on board the physician that willing to take care of the patient and move them along. And then at some point, I think it's important for the physician advocate or your physician champion to have a conversation with the medical director, or with the physicians that are not as on board with this as possible, to see what can we do to convince them that this is safe to do. I mean, maybe they need the X waiver done. Maybe I don't know what it is. Maybe they just need some handouts from California Bridge to say, hey, this is what's going on. Maybe they need one of the physicians to come and do a little grand rounds thing at your place. I mean, whatever you think it is. But pretty much every hospital now has a substance use expert. It might not be somebody that's boarded, but they might, be in internal medicine, or something else, and they can obviously give their own perspective locally. But people are always going to have slightly different practice patterns. The important thing is, this one is pretty focused. There can't be too many variations on this practice pattern, since we don't have that many other alternatives to the treatment for this right now. So, there's lots of things you can have variant practice patterns, but this one is not one of them, in my opinion.
Yeah, thank you for those strategies. And remember, focus on the ones that you are winning over. That's such great advice. I'm gonna move on to Darian. Dr. Laftapor wanted you to share your experience and how to start a conversation about BUP and engage your providers. Can you give us some insight to that?
Yeah, definitely. Can you guys hear me? We're good? Okay. So my name is Darian Silva. I am KDEX certified. I have been in substance abuse coming up on 5 years now. I originally started in the inpatient setting, and I worked at an inpatient rehab within the Valley here, and then joined California Bridge for the Eisenhower. And so I have a couple points, and I'll touch on that one, the one that you told me about right now. So I want to start with when I first started, the hospital setting is very intimidating. I know we have a lot of sons out there who are a little intimidated, not really navigating a hospital setting. It's very different from an inpatient setting. there's a lot going on, especially in the ER. So it's different from inpatient is nice and quiet, and ER there's always something going on. So I would just really just reach out to, I want to focus on providers that you get along with, kind of like Dr. Laptapor was sharing. I think for me, when I first started, there was a lot of pushback. Certain doctors didn't have the knowledge of what we were doing and what we were kind of coming in with. And I think it's really important to focus on providers that that you get along with, that you do have rapport with. A lot of my doctors right now, I mean, I lean on about 3 to 5 doctors who are ex-waivered currently, and I really they help me out a lot, and they're my go-to. So I feel like if you start to find those people who you have those rapports with and water those relationships, it's going to make your life really easier, and you'll be able to navigate, you know, your position a little bit better. As far as the harm reduction, when you're starting that conversation for with some doctors, I like to kind of use harm reduction as something that's enticing for these doctors, and I just let them know that with harm reduction, as far as the Narcan goes, it's gonna bring people back into treatment versus, you know, having them not be able to come back to treatment, unfortunately. And I also, when talking about harm reduction, for what we do out here, we don't have needle exchanges, but if we do have somebody who comes into the ED who's probably not looking for MAT, I will refer them to needle exchanges that we have. We have one currently in Palm Springs that just got put up. So I like to kind of let doctors know about that so they know that resource. And I also wanted to touch on when a healthcare provider, Sherry, like you kind of shared, once you've kind of done your spiel and they won't prescribe that buprenorphine for a patient. When that first happened to me, I was like, oh no, like I don't know what to do. I, you know, can't help this patient. But what I found was, this is going to sound kind of funny, is just find a doctor who will do it. And that's where nurturing those relationships with other providers, other ex-waiver providers kind of comes in, because you're able to lean on them and say, hey, I wasn't able to get this for this patient. Maybe you can help me out. And now you'll notice that they'll start to come to you and let you know if other providers have questions. Once they know that you're kind of confident and you know, you might not know all the answers, but you're going to try to figure it out, they're more likely to want to lean on you. So I would just say, find somebody, you know, who will do your the Suboxone prescription for you. But also, worst case scenario, there's nothing wrong with referring them to another California Bridge hospital that might be closer to them. That's happened to me a couple times, where I have people who are a couple hours out, and they'll come to this hospital not knowing there were other sites. I'll refer them to other hospitals that operate California Bridge, but also referring them to a Suboxone clinic. We have one in Palm Springs here, Desert Comprehensive. So I will refer them to Desert Comprehensive for either, I think they do methadone and Suboxone daily dosing. So worst case scenario, I can provide or resources for that. And then kind of have something set up so that they can come and get a full term, you know, prescription here at the hospital, but at least they have that kind of resource for them. And then last but not least, you're not going to know everything right away. Same with residents coming in. They're not going to know a lot of our protocols as far as buprenorphine goes. But one thing that I did that really helped was, I know California Bridge has these on their sites, and this should actually be in our toolkit as well. It's the Bupe Hospital Quick Start Guide, and it kind of looks like a little roadmap. So what I did was I printed those out, I laminated them, and I put them all over the hospital, or actually all over the ER. That way, if there was any confusions, if the doctors weren't sure, if they kind of felt, you know, if I felt they had pushback just because they didn't know much about Bupe, I would just refer them to this, and that saved a lot of time. And they kind of felt a little bit more comfortable having a quick guide to kind of go off of, since there are a lot of doctors and residents who are just not really seasoned in buprenorphine. But that's kind of it.
Thank you very much.
There was one question here that says some of the docs are by Christine are resistant because they are introducing another drug. When there are other drugs in the patient system, they may complicate things. I think that's a good point, but you know, often, you know, they might obviously have a stimulant on board in addition to opioids. But, for all of those, actually bupe helps for what it's worth. So, it's not the only treatment for the other ones, but, it's a good start to all of these many drugs that these people have on board. So for what it's worth, I think the main thing people worry about is, what do I do if they start withdrawing? And, really the treatment is to give more bupe until they stop withdrawing. And so I think, and that's probably in the quick start guide.
Yeah, absolutely. Rebecca, do you want to just mention, I know we're running short on time, but I know you were going to talk about the hotline then and the physician to physician warm line to get some, so if you can go next, definitely.
Absolutely. Thank you, Shram and Darian. I really love your guys' perspective, especially coming from like a rural part of California. Oftentimes things are a little bit more difficult when you're in a rural place. So I just want to spotlight their efforts and their amazing patient outcomes. It means so much. Even if it's just one patient, it means so much to that patient. I want to leave you with this. If I can give you one tip about pushback, is to not take it personal. We have all experienced pushback. Those of us with programs running 3 years and beyond, we still experience pushback. Pushback is part of the process. And I like to meet it with compassion, right? So bring that compassion that you treat your patients with, along with respect, and give it to your team, give it to your colleagues, and use it as a teaching opportunity. I always like to guide my providers, whether it's a social worker, an RN, an advanced provider, or a physician, guide them to the resources. Chances are, just as Shram mentioned, they just don't know. They haven't been taught. This is not new, in medicine, but it might be new to them. So give them the tools that they need to create a positive patient experience. And as navigators, we can come to the table and use our California Bridge resources, right? We're not on the lane to like tell doctors what they should be doing, but you can point to your algorithm and say, per California Bridge, this is this algorithm. You could use this to treat this individual in opiate withdrawal, and I will take on the rest. I will link them to care. We're going to create a positive patient outcome today. Let's do it together. And give them a resource like the, pardon me, I'm going to share my screen really quick and try not to mess this up. I'm going to give you some resources today, along with in the chat and on Slack afterwards. The first resource I want to share that I'll also put in the chat here is the California Substance Use Line. This is 24/7, you guys. This is why I like this one, because I know on a Saturday at 3 a.m., if my PA is in trouble and they don't remember what the algorithm's telling them, they're going to call this substance use line and get specialized help for treating substance use and withdrawal in the emergency department. Again, I'll share this resource on Slack. This number here, 844-326-2626, is 24/7. The next couple resources I want to show you, familiarize yourself with the buprenorphine hospital quick start protocol. As since this is not our lane to memorize this and take on the pushback individually, like Dr. Lockepour mentioned, but it does help if you know this algorithm and you're able to point to it and help your provider use it in patient circumstances along with that 24/7 substance use line. Another tool I wanted to point out is our hospital education tool. So this tool really helps create visibility of your role hospital-wide. You can use this for your providers, tack it up anywhere they let you. Folks who answer the phone. This is a really important tool to create buy-in and visibility to your role. And then the last resource I want to share with you guys, if you come into our website and hit training and then tech assist, is actually a request form where you can have an expert from California Bridge come and talk to your entire provider team about buprenorphine, about withdrawal, about substance use, whatever you need at your site. We have experts for it. So don't be shy about filling out this form. It really does help, you guys. I've seen it happen in real time, and our providers just like turn on the charm. They're lovely, they're infectious, they're outgoing. They really help. So use this tool. Again, I'll pop that in the chat. And I just want to mention one last thing. The stigma that we experience for our patients, it's not a personal failing of that individual. It's our culture, right? And we're all steeped in it. So just remember that we're changing minds one at a time, and we can do it, but it takes time. It doesn't happen overnight. So be compassionate and come to the table for all of your team, and you will see the ripple effect that it can create.
All right. Thank you, Rebecca. I love all those resources. Those are wonderful, and they're all on californiabridge.org, you guys. So feel free to use them. I want to thank our panel, Dr. Laftipor, Darian, and Rebecca. This was really, really engaging and fun. I think Christine Norwood says one of her doctor explains it. That's an excellent way. He's teaching us, you know, to navigate that pushback. The last thing I wanted to say is we're doing these monthly updates. You can come and bring questions, or if you just want to submit a question, that's fine too. Our next training is April 28th. That is for a full hour, and that will be mental health and trauma-informed care for navigators. This is something we tried to do last year and it didn't work, but this year we have our authors of our document, and they will be giving a full presentation. So we're really excited about that. I really hope that we helped with the pushback, and feel free to answer, put a question on Slack. We will follow up today. Thank you for coming, and see you next time on Navigator Update. Bye, guys.
Thanks. Bye.